It's time to put your health in your own hands. Get ready to learn from today's top health and wellness innovators and thought leaders on Optimal Health Radio. Now, here's your host.
Hi, everyone. This is Dr. Tami Patzer, and this is Optimal Health. And I'm really excited because today I'm speaking with Dr. Stefan Getzik. He is a 2014 graduate of Palmer College of Chiropractic, located in Davenport, Iowa, and he has a doctorate in chiropractic medicine. He's completed his undergraduate work with a degree in sports management from California University of Pennsylvania, located in California, Pennsylvania. He is a doctor for the minor league team, the Washington Wild Things in the Frontier League, and he's headed to the Czech Republic, where he is the team doctor for the U.S. Ball Hockey Masters team. And he's treated thousands of patients and has implemented his knowledge in chiropractic and rehabilitation over the years. And Dr. Getzik is the leading medical laser therapy specialist in the Washington area. So welcome, Doctor.
Hi, Dr. Tami. How are you?
Great. The first question I wanted to ask you is because you have such an amazing background in chiropractic and especially with sports medicine and being a team doc for those specialized teams. I wanted to ask you more about your practice in general. So what do you think separates your practice from all the chiropractors out there?
Yeah, what separates us from all the other chiropractors is that we really want to strive on making sure the patient is better, whether that be, laser therapy or chiropractic or massage therapy or physical therapy. We want to get you better, quicker, and with less money out of your pocket. That's what healthcare should be about. It's not right now. And that's what we're trying to do for the patient, is to save money in their pocket, but get better quicker.
Well, I certainly can agree with that because I know that many people, chiropractic and laser therapy has been like a godsend to them because of the reduction of pain and just the ability to move your body. So tell me a little bit more about your background and your practice.
Yeah, so my background obviously is sports management with a concentration in wellness and fitness. It was at California, like you said, which is a fantastic school. I knew I'd be coming out with student loan debt, so I wanted to go to a small school. And then I got accepted into Palmer College of Chiropractic. I took a couple routes to figure out if that's what I wanted to do. I decided chiropractic was the route for me. My family's all pharmacists, so I'm kind of the black sheep of the family to an extent. But I went to Palmer. I came back to Washington, and I started my practice in 2014. And we've literally grown to be the number one chiropractic clinic in Washington County. We have over 333 Google reviews, which is extremely big. You don't see a lot of places have that because we do take care of our patients the way we want to. So that's my clinic background. I treat the Wild Things. I'm with the USA Ball Hockey organization. So our goal is to take care of as many athletes, and even the people that are coming in here are still athletes. And they're the athletes in life. Not so much athletes in sports, but they're athletes in life. So we try to get across the fact that, if you're going out and doing something, you're still an athlete, and we want to make sure that you're taken care of. So we have a whole wellness program here, whether it be chiropractic, physical therapy, laser therapy, massage therapy, to get you better.
So I wanted to ask you, you mentioned a few things. I guess there's a plethora of different things that you can treat with chiropractic and laser therapy. So I wanted to dig into laser therapy today.
Yeah.
because
Yeah.
it's something that it seems new, but I don't know that it necessarily is. So can you tell me more about the fact that you've added this specialized laser therapy to your practice?
Yeah. So laser therapy has been out for a long time. I think about 15 years now is when the first laser came out, class 4, which is what we have. And, you know, this treats a lot of ailments. I don't want to say it's a miracle cure, but it really has helped people get away from surgeries. But it takes care of skin conditions. We take care of neck, back, low back issues. We've seen people with sciatica or radiculopathy, which is pain in the arms and the hands, in the legs and the feet. So we've taken care of that. We've taken care of peripheral neuropathy. That's something that's really big. People don't get treated for peripheral neuropathy ever. And there's really no cure for it. And we're seeing that we're getting blood flow back to the area. We're seeing that we're getting the cells and we're regenerating tissue. That's impressive in itself. And like you said, we're the only clinic in Washington County that have this. So we're seeing people coming in for tendonitis and I could go on and on about the conditions that we can treat. But it's just a great tool to help our patients get better faster.
Well, I know that one of the main things that people need is help with the pain relief that happens in your athletic life that we lead.
Exactly.
I personally, I slipped and fell, and it hurt my hip, and then it escalated to my knee. And I was talking to one of your colleagues, and they told me, they said, yes, laser therapy can help that. So I wanted to ask a little bit more. So how exactly does laser therapy work?
So this is, the easiest way I can describe it in layman's term is just, what we're doing is we're bringing blood back to the area. We're regenerating blood vessels and we're bringing cells back to the area to repair tissue. So when we bring that, when we bring that stuff, the cells back to the area, that's helping to heal the tissue. It's helping to heal the wound. It's helping to heal the bones. So really, that's the simplest explanation to describe how laser therapy works.
So how long does it take? I mean, I know that, back in the day, chiropractors sometimes got a little bit of a bad name because the treatment would take a long time. How long does it take generally to, not necessarily, I don't think you can say cure it, but to see relief or pain reduction?
Yeah, that's a question I get all the time. And it's a hard answer to answer because everybody's different. There's never, I don't know until we do the first session, how it's going to react with your body, how it's going to heal you in a sense of how fast it's going to heal you. So the answer for the short answer is I don't know. But once we start getting into 1 and 2 treatments, then I kind of know, where we got to go to, how much we have to do, what the type of, energy that we need to use to help the healing process. But right off the bat, somebody coming out of the gate, I don't know for sure until I start to actually evaluate them and treat them.
So what type of response have you gotten from your clients? Do they come back and tell you, how they're feeling and the type of relief they're getting?
Oh my God, we have, tremendous results here right now. Right now we have about a 95% satisfaction rate, which I don't know how many medications or other treatments can provide that. But we have people coming in here and saying, oh, well, this might be snake oil. Well, and then they get 1 or 2 treatments and they're sending people in here left and right because, it's a fantastic treatment for them and they want people to experience it. We're seeing people that are canceling their surgeries and, in a couple of visits, they're seeing results and they want to cancel their surgeries. We're seeing athletes that, and this is a big problem in our country now, no matter where you go, is opioids and drugs, people from being in pain, and they're coming in and they're getting laser therapy and they're getting off their pain medications. So, and that's all in that 90-95%, satisfaction rate that we're seeing. So it's a really great result right now.
Wow. That I know that pain relief without drugs is really important, because I've always been an anti-drug person. So I have gone through pain without taking medication. And then of course you're always looking for, something like, I call it rehabilitation, physical therapy, when
Yep.
somebody can help you, and relieve your pain without taking drugs. So I think that's important. And that word of mouth, I think that's your biggest sales point when you think about it, is, hey, my patients are coming back saying thank you. And then when they tell their friends, oh my God, I have to go see Dr. Getzik, so that I can not have to take drugs. And that's important, because
it's very important.
more and more people, they want to lead that healthy lifestyle into their older age. I mean,
exactly.
I have grandchildren, and I look into the future, I go, well, I want to be active, in my 70s and 80s. I want to be able to with these babies. And so I think that's an important point. So with laser, what would you say are the major benefits of it, related to how most people's bodies respond?
I think most people respond very good, in the sense that they are usually getting their results, and it's a fast result. So is that the answer I'm giving you for your question?
Well, I'm just thinking about inflammation, and like, I always know, like, when I have inflammation, because my hands feel tight and the swelling, and I think you said it helps with things like swelling, and it's rebuilding the blood flow to the part. So is there anyone who can't be somebody who uses lasers?
Yeah, so we tell people that are on statins, blood thinners, to really stay away from it, just because we do see adverse reactions with the blood thinners, and then usually children that have growth plates that are still, obviously they have growth plates because they're still growing. We don't want to see somebody like that. So a younger child is probably not the best, but there are certain things that warrant us to go around those, and then the people that have active cancer, that's really, we want to avoid anything with active cancer. So those are the real big three reasons why we deter people from using our laser.
So I take it that when somebody comes in for a consultation, you go over all of their health issues and make sure they're a good candidate for it.
We do. Yeah, we do. We do a full, check on their history, blood pressure, vitals, just like you would at your medical practitioner. You're going to get the same type of exam. We just go a little bit further in the fact that we take x-rays and we physically do orthopedics on these people, so that we can, or the patients, so that we can make sure that we're doing the right type of treatment, and whether laser is going to work for them or not.
So here's a question I've been thinking about: science. Everyone wants to know if laser treatments have any studies backing them up. Are there studies, scientific studies?
Oh my God, there's studies. There's over 3,000 case studies on this right now. I know from my colleagues, there's a lot of big name hospitals out there that are using this laser. So the amount of case studies that and articles on this are just out of this world. They'd probably wrap around the whole world a couple times by how many people are researching this and finding out that it's actually doing what people, what we are saying that it's doing.
So it's all about getting rid of pain and also eliminating potential surgeries and not having to take drugs.
Exactly. That's the big that's the big picture of it. We want to ditch the drugs and skip the scalpel.
Ditch the drugs, skip the scalpel. Well, it sounds good to me because like I said, the drug parts, there's always so many side effects. Speaking of side effects, are there side effects to laser therapy?
There are not any side effects to laser therapy. We know right now that there's absolutely none that have been brought up in any of the case studies.
Oh, wow. So more than 3,000 case studies basically saying that laser therapy works on all of these different issues. So in your practice, are you focusing on any particular, you named a lot of different uses. Are you focusing on any particular thing?
We do. Obviously, with us being chiropractors, and physical therapists, we focus on the back a lot, right? That's a big one. People come to us for back pain. But we also are focusing on elbows and shoulders, knees, ankles, hips. So those are the big, the joints are the big issue that people are having. And that's what we tend to lean towards. But we do have people that have other conditions that we've been treating regularly.
Right. You mentioned that neuropathy, and I guess that's when you have like pain in your feet or in other parts of your body.
Yes, there's around the nerves, there's something called myelin. And that myelin is actually going away because the blood vessels are basically disintegrating. And that's what's causing the pain in the feet, the pins and needles. So our goal, like we said, as a regenerative medicine, our goal is to, bring those blood vessels back so it can help with the myelin, and keep the myelin sheath there so that they don't have the pain and they don't have the numbness and tingling or the pins and needles.
Wow. I see I'm learning all of these very interesting things. I'd heard the term, but I didn't know what it was that made it so that it hurt. So if somebody wants to reach out to you for a consultation, find out more, how do they do that?
So they can get on our website. It's www.ReliefNowLaserWashington.com. They can also get out to us through our chiropractic office, which is WashingtonPAChiro.com. They can reach us on two numbers. We have our laser clinic number, which is 724-344-3754, or the chiropractic clinic is 724-222-2074. So they have multiple options to get on and find us, to get scheduled up for a consultation.
Okay. So everyone just know that I'm also going to make sure that I have clickable links in the show notes for this so that you can easily reach out to Dr. Getzik. Before I let you go, is there anything else that you'd like to add about what you're doing and your services?
No, if the biggest thing for me is, if you're in pain and you've been struggling with pain and you're struggling with, taking tons of pain medicine, or you're contemplating surgery, come talk to us. We deal with a whole slew of issues, and we're seeing success with this. And we want people to understand that there's other options out there than just surgery and medication and physical therapy and chiropractic. There's other options out there, and this laser will show you that. And I'll prove that to you, and we'll make sure that you get better, and we'll make sure you get better faster.
Well, that's really awesome, because I know exactly what you're saying when people will suffer for months with pain. And I actually, when I fell on my hip and hurt myself, I tried taking Tylenol, ibuprofen, Aleve, everything I could, and it didn't do anything.
It didn't do anything.
And then you literally, you get to a certain point where you're just like, you cannot function properly.
Exactly.
So it's
the funny thing is, medicine only lasts a certain amount of time, right? We know it has a half-life. So it could last 4 hours. It could last 8 hours, right? Well, we know the laser, it takes almost 18 hours for healing. So you're literally healing from the time we give it to you and for 18 hours after that. I mean, how many other treatments can you have that last that long for a healing process? You know what I mean? And get results within that time. So
I think you just said a magic word. The difference between drugs and surgeries is more like you're masking the pain.
Exactly.
And laser is healing your body. So then you're actually having a healing rather than just a masking.
Just a masking. Exactly.
Wow, that's really important. So everyone, make sure that you go check out the doctor's website. And I really appreciate you explaining more about laser therapy today, because it's something that, as you said, more and more people are looking into it. And with more than 3,000 scientific studies backing it up, I would say it's something that if you are in pain, you definitely should go take a look at it and learn more. So I really appreciate it, Doctor. Thank you.
Thank you, Doctor. Appreciate it.
You've been listening to today's top health and wellness innovators and thought leaders on Optimal Health Radio. To get more solid health and wellness information, visit optimalhealthradio.com.